This project used the Golden Retriever dog as the basis for examining the effects of neutering on the risk of developing several diseases found to be common in the breed, distinguishing between males and females. Using the records of 759 client-owned dogs from the University of California's Veterinary Hospital, aged 1 to 8 from January 2000 to December 2009, these dogs were classified as neutered early at less than 12 months, neutered late at 12 months or older, or intact. In order for records to be valid, they must contain the animal's date of birth, date of neutering if neutered, and date of disease onset to ensure neutering was prior to disease. The clinic database was scanned for cases of common diseases. Only those with at least 15 cases were included in the study. Cases lacking conclusive diagnostic were not included. Body condition score was also taken into consideration, as excess weight can attribute to the onset of joint disease. Studies suggest neutering may lead to increased body mass. As can be seen, joint disease and cancer was much less common in late neutered male golden retrievers when compared to neutered early or to a lesser degree left intact, excluding MCT, which was most common in late neutered males. CCL and LSA were most common in females neutered early. Rates of HAS and MCT were considerably increased in late neutered females. The results gathered from this study are breed-specific and cannot be accurately extrapolated to any other population of dogs. The occurrence of all 5 diseases was increased in both males and females when neutered early or late when compared to those left intact. The pathophysiological signs suggest that the role of gonadal hormones in controlling closure of growth plates is a major factor of joint disorders in neutered dogs, especially those neutered early. This is apparent for joint disorders HD and CCL. Gender also affects the onset of joint disorders, as growth plate closure occurs earlier in males than in females. The role of gonadal hormones on the onset of cancer is not so obvious. However, there are strong indicators that early neutering in males increases the rate of LSA, and late neutering increases HAS and MCT in females. Neutering males in puberty should result in minimal disease. Female neutering is more problematic, as whilst estrogen is in the system, it protects against some cancer cell activation, reducing risk of colon cancer, which is reflected in intact females. Early neutering before estrogen production also reflects low cancer occurrence, but shows increased CCL rates. No conclusive best time for female neutering can be drawn from this project.